A lot of people ask us, how do I file an appeal? Medicare has denied the service that I think I need or that my doctor thinks I need. What is my recourse and what can I do about it? Well, you always have a right, no matter what kind of Medicare plan you're on, to file an appeal. And there's usually a 5-tier process to filing an appeal, starting with a redetermination. And whether you're on original Medicare and you're doing it with Medicare directly, or you're on an Advantage plan and you're doing this through the plan, you have this option to appeal if you don't agree with the decision. Now, to get more information on this, you want to go to Medicare.gov. Medicare.gov is a tremendous resource for you when it comes to claims and appeal type information under the original Medicare program. So you're at Medicare.gov and you can scroll along the top and you're going to see providers and services. And if you go under the Learn icon, you're going to see an option for claims, appeals, and complaints. So you'll see claims, appeals, and complaints or grievances. An appeal happens, if you click on this, is when you think that you deserve to have a covered healthcare service, supply, or item, and you think Medicare should cover it and they won't, or they should pay for a healthcare service, supply, or item or drug you already have and they won't, or if you think that there should be a different amount rendered for the service, supply, item, or prescription that you have. You can file an appeal if Medicare or your plan stops providing for or paying all of home health care services, supplies, items, or anything that you think you still need. Or if a drug management program labels you at risk because of overutilization of the system, this means you can have limits that you can access for drugs like opioids and so forth. You can appeal those decisions. So how do you get a determination? How do you go through this process? Well, like I said, on Medicare.gov, it's actually tremendously helpful. And the appeals process, if you look under Original Medicare, now this is for people who have a red, white, and blue Medicare card as their primary insurance. And usually you're going to have a supplement plan like a Plan G or a Plan F. A lot of times when Medicare denies a coverage determination, what happens on those Gs or Fs, they're also going to deny the service. But a common mistake that I see people make is they try to appeal that decision to the insurance company, and the insurance company is not the one who actually made that original determination. So to do the appeal, you really do have to contact Medicare directly to get that ball rolling. And under How Do Appeals Work, you would click on Original Medicare. And here you'll see there's 5 levels of appeal. The first level is called redetermination. There's a form. You can fill out that form. You can provide supporting documentation from your provider or services, write a letter explaining the service, document everything and ship that off. If it gets approved, fantastic. The claim can be reran. If not, it'll automatically in the determination letter tell you how to move on to step 2, 3, 4, or 5. So it's kind of like the Supreme Court system of appeals that you're able to do through the Medicare system. Now, if you don't have Original Medicare as your primary insurance and you're actually on a Medicare Advantage Part C, that's otherwise known as a Medicare health plan. And you'll see in this same section on appeals, if you're not Original Medicare and a supplement, the next step over is Medicare health plans. And this is really the Advantage plans. Follows the same or pretty much similar process, except for that you're usually doing this directly through the plan, and they're walking you through those steps and determinations and taking you along the way. Now, if you disagree with your Part D prescription drug plan, remember that Part D is never done directly by Medicare. So essentially all the Part D organizations that offer prescription drug coverage, whether you get that embedded as a Medicare Advantage plan or as a standalone product that you would add to Original Medicare and a supplement, you have the right to appeal prescription, but you're always going to be doing it directly with the insurance company. And again, it has the 5-step process. It works very similarly. You're going to take all the information and put it in your original redetermination request. You're going to write a letter. You're going to contact the plan and get the ball rolling. For more information on how to file appeal, don't just take it. If there's a reason that you need to have continued services, it's worth taking the extra step to try to get that paid for you under the Medicare program. So please, as always, contact us at blackpointinsurance.com. Thanks, everybody.